Okay, we are on to the third presentation that is by Thomas Liu and Joy Lin from Leland High School in San Jose, California, and Henry M. Gunn High School in Palo Alto, California, respectively.
Good morning. My name is Joy.
My name is Thomas, and our project today is entitled Hedgehog-Gli Signaling Promotes Cell Proliferation and Epithelial-to-Mesenchymal Transition in Lung Cancer. So first, we're going to take a look at lung cancer in the United States, where we see that it's the most fatal cancer on two premises. It contributes to more cancer-related deaths per year than colon, breast, and prostate cancers combined, and it also has one of the lowest 5-year survival rates, around 16 to 18%, showing very little improvement over the past 3 decades. This is seen even when you're using some of the most active treatments for lung cancer, including radiation therapy, chemotherapy, and surgery. This warrants a need to take a look at the challenges that we face in treating lung cancer today, where we see a high failure of treatment rate. This can be attributed to events such as metastasis or the spread of lung cancer from a patient's lung to another part of their body. And we see that 70% of non-small cell lung cancer patients have experienced metastasis before. Based on this, we can see there's a urgent need for novel therapy able to first reduce the proliferation of lung cancer cells and second, inhibit metastasis of lung cancer. Now, to do this, several pathways have been examined by researchers in many cancer fields. One of these is a Hedgehog-Gli pathway, where the hedgehog protein acts through the patched and smoothened as well as multiple other proteins, ultimately leading to an increase in the creation of the Gli protein. The Gli protein is a transcriptional factor. This means that it aids in the transcription or the creation of multiple other proteins. Some of these include Gli itself, smoothened, or even cyclins. Many of these have been linked to the development of cancer, and as such, the entire Hedgehog-Gli pathway has been implicated in multiple cancers in the human body. Another pathway linked to the development of cancer is EMT, or the epithelial-to-mesenchymal transition. In EMT, cells go from an epithelial state to a mesenchymal state. That is to say, in an epithelial state, these cells have a high number of cell-to-cell junctions and therefore low mobility. These cell-to-cell junctions can be made up by surface proteins. Some of these include E-cadherin or other cadherins that help to hold these cells together. In a mesenchymal state, however, these cells have much lower number of these proteins and therefore are more able to move around with these fewer junctions. And therefore, the EMT has been linked to metastasis in multiple cancers as well. Now, what our project aims to do today is to connect the Hedgehog-Gli pathway to EMT, and therefore this brings us to our objective today, which is first to investigate relationships between the Hedgehog-Gli pathway, E-cadherin, EMT, and therefore metastasis, and also to take a look at how Hedgehog-Gli signaling can affect cell proliferation. Based on this, we'd like to develop a novel therapy able to target both proliferation and metastasis in lung cancer. Now, to do this, we use 3 key questions which served as a basis for our experimentation, and today will serve as a foundation and framework for our data.
So first, we examined the expression levels of Gli and E-cadherin within both patient samples and lung cancer cell lines. And to do so, we used a series of methods which are shown here. To measure the expression levels of RNA, we performed qPCR, and we also conducted Western blottings as well as immunofluorescent stainings in order to test for the expression levels of our target proteins. Here is the RNA information obtained through qPCR of the Gli1 and Gli2 gene expression. This was performed on 63 different patient samples. In comparison to a normal lung sample, which is set here as 100%, over 80% of these patients showed higher levels of Gli, and nearly 50% of these patients showed 10 times as much Gli expression in comparison to the control. And this is highlighted by the circle in red. On the left here, we can see an immunofluorescent staining of a patient sample, and this is representative of the entire data set we used. In the top row, we can see that in the normal patient sample, there are low levels of Gli1. In the same patient's tumor sample, there are high levels of Gli1 found, and we also noticed that the red areas of Gli1 often concurred with the blue areas of nuclei, which is consistent with the fact that Gli acts as a transcriptional regulator and should be located within the nucleus. And this same trend of elevated Gli was also observed with Gli2 within patient samples. This chart on the right shows our findings taken from qPCR, again to test for Gli1 and Gli2 expression. This was performed on 17 different lung cancer cell lines, and we observed that nearly 70% of these cell lines showed elevated Gli expression in comparison to a normal cell line. And our results indicate that there is elevated Gli expression found in both patient samples as well as lung cancer cell lines. Here on the left, we can see further immunofluorescent stainings being performed on patients. In the top panels, we can see that when the patient shows low levels of Gli2, there are high levels of E-cadherin. Conversely, when the patient has high levels of Gli2, there are low levels of E-cadherin associated with that. On the right, we can see a Western blotting procedure originally performed on 17 different lung cancer cell lines, with 2 representative cell lines shown here, A549 and H2170. In A549, we observed high levels of Gli2 along with low levels of E-cadherin, and in H2170, we observed low levels of Gli2 paired with high levels of E-cadherin. And our results suggest at an inverse relationship between Gli and E-cadherin among both patient samples as well as lung cancer cell lines. We conducted further assays on these 2 cell lines in order to test for the relationship between hedgehog to Gli signaling as well as EMT.
The second part of our total study wanted to investigate the relationship between Hedgehog-Gli signaling and cell viability. And to do this, we used a cell viability assay through a series dilution of a Gli inhibitor to test this. So as we can see here, our data shows that at increased concentrations of a Gli inhibitor, cell viability was definitely decreased. We also noticed that cell viability was more greatly affected in the A549 cell line in blue as opposed to the H2170 cell line in red. This is interesting because it parallels our findings that the A549 cell line had higher ambient levels of the Gli2 protein compared to the H2170 cell line, and also that we saw similar results using another Hedgehog-Gli pathway inhibitor. This is vismodegib, another drug recently approved by the FDA for use in skin cancer. And we saw similar correlation, that at increased concentrations of this compound, there is a subsequent decrease in cell viability. Now, the third part of our experiment wanted to take a look at how the hedgehog to Gli signaling pathway could promote cell proliferation. And so we used the wound healing assay as well as immunofluorescent stainings to examine this. In a wound healing assay, a monolayer of cultured cells is imaged on days 1 and 4 of a pipette scratch as well as growth in various proteins, drugs, or media. And some sample from our data can be seen on the right-hand side over here. On the top is a control sample where there's clear growth from days 1 to day 4. While on the bottom over here, when these cells were treated with a Gli inhibitor from these 4 days, the cell growth is much less evident. Our findings are summarized on the left-hand chart where we see that an inhibited hedgehog to Gli signaling pathway results in reduced cell migration, while a stimulation of this pathway results in an increased or more visible cell migration. Based on this, this data allows us to conclude that there was a link between the Hedgehog-Gli pathway and cell migration, but we wanted to examine what proteins could be involved in this process. And for this, we used immunofluorescent stainings.
So here on the left, we can see the immunofluorescent stainings for these cell groups. And on the leftmost side, we can see H2170 cells. In the top left panel, in these control cells, there are high levels of E-cadherin found. When these cells are given hedgehog protein, which stimulates the hedgehog to Gli pathway, there are low levels of E-cadherin found. On the rightmost panels, we can see A549 cells. And in these control A549 cells, there are low levels of E-cadherin. When these cells are given Gli inhibitor, they exhibit much higher levels of E-cadherin. Our results from qPCR are summarized on the right over here. And in general, we observe that when you stimulate the hedgehog to Gli pathway, there are lower levels of E-cadherin, while when this same pathway is inhibited, there are much higher levels of E-cadherin. Our data suggests that hedgehog to Gli signaling suppresses E-cadherin expression. Here we can see further immunofluorescent stainings performed on the previously mentioned wound healing assay. The dotted white lines represent the migration front that was created by the pipette scratch. In panel A, we can see that in control cells close to the migration front, there are low levels of E-cadherin. As we progress farther away from the migration front, we can see that the cells begin to possess higher levels of E-cadherin. And in panel C, we can see that when these cells are treated with Gli inhibitor, which inhibits the Hedgehog-Gli pathway, there are high levels of E-cadherin found even towards the migration front, which may explain why during the wound healing assay, these cells migrated much less in comparison to the control. Our findings indicate that Hedgehog-Gli signaling suppressed E-cadherin during cell migration.
Returning back to our original 3 key questions, we used the 3 parts of our experiment to come up with these 3 answers to these questions. Based on this, our results indicated that Gli and E-cadherin protein levels are negatively correlated in lung cancer. We also saw that the inhibition of a Hedgehog-Gli signaling pathway would lower cell viability in these cells, and also that the pathway may actually promote cell migration, possibly through the E-cadherin protein. Based on these 3 answers, we came with a larger conclusion, and therefore we conclude that Hedgehog-Gli signaling does promote cell proliferation and epithelial-to-mesenchymal transition, both leading to proliferation and metastasis of lung cancer cells. Based on this, we believe that we can use inhibition of the Hedgehog-Gli functions to help suppress EMT as well as cell mobility in lung cancer, helping to treat lung cancer in many non-small cell lung cancer patients. There are also multiple directions where we would like to take our project, primarily through molecular mechanism assays to see how the Hedgehog-Gli pathway can affect proteins such as E-cadherin or molecular transitions such as EMT or simply pathways such as metastasis. Based on this, we believe that we can use Gli inhibitor as a novel therapy for lung cancer, able to target both proliferation and metastasis through EMT in these lung cancer cells. This is a list of references we used to write our paper as well as conduct our research. And to conclude, we'd like to thank the judges and audience for their time here today, as well as the Thoracic Oncology Lab at UCSF, the Siemens Foundation, College Board, and George Washington University for making this presentation possible today. Thank you.